Now, we are very concerned about the fact that the consumption of alcohol in the country is pretty high. Well, it's estimated that 31% of South Africans 15 years and older are current drinkers, or they must have consumed alcohol in the past 12 months. This is a WHO Global Status Report which was done in 2018. Despite the low proportion of South African adults who drink, we're one of the countries that drink the most, and in the WHO Afro region at 64.6 grams of absolute alcohol per capita per day. That's about 5 and 6 standard drinks of 12 grams absolute alcohol. That's about 15 meals a day. Now this, it's important because it's higher. The average in the other countries is 40 grams per drinker per day. And so that's a matter of concern, that it's actually a matter of record. During the level 4 and level 5 lockdown, a study done by Perry and others showed that there was a 60 to 70% reduction in trauma admissions because of that lockdown at that time. Conversely, when the alcohol restrictions were lifted during the level 3, facilities reported up to 60% of increase in trauma emergency center admissions and up to 200% increase in ICU on trauma admissions. So some of the modeling that was done to predict the impact of an alcohol ban, and these models was demonstrated that introduction of a suspension of alcohol sales could result in 20% reduction in all trauma and 40% reduction of all alcohol-related trauma by the 3rd week. So when we get into the surge and we require more of our wards to be available, it therefore means that the real problem, and many of us would have seen how in the media some of the staff or health workers have indicated the pressure that is caused by the admission of patients with trauma. The problem with those patients is that basically breaks the routine in the hospital management of patients. If somebody comes and is bleeding, you have to drop the person who's sick and go and deal with the one who's bleeding because it's an emergency. There are a number of instances where, in fact, you have to even stop theater and rush in someone who is having a trauma because of the nature of the bleeding, just to be able to save lives. Alcohol is a big factor in a number of people who would have come in with motor vehicle accidents, gunshot wounds, and penetrating wound injury, which ultimately results in a lot of attention that is needed at that point. So this is the reason why we believe that during the surge, we need to actually focus on one set of problems, and that is the increasing numbers of those who are coming through. And they will be needing urgent attention, and we shouldn't find anyone coming in and only to find that the beds are blocked by people that could have really been saved from the accidents that brought them to hospital.